develop and evolve and mutate. And so the variants question, always, it doesn't matter what disease it is, but especially if we're talking about a virus, there are worries that you will see mutations. And we have seen mutations or variants in everything from flu to HIV to the common cold, right? And the thing with coronavirus that's been interesting is that it actually has not mutated as much as many people feared it would because of the kind of virus that it is and the way that it replicates. Early on, we were worried we would see even more variants in some ways than we've seen. And for the amount of spread that this virus has had, it's a very, from the virus's standpoint, it's been hugely successful, right? The spread in a way that many people are asymptomatic, don't have symptoms or mild symptoms. That's different than a lot of other diseases. And it's been one of the things that's made this hard to control. So it's had a ton of opportunity to spread. And every time a virus spreads, that's when it has the opportunity actually to mutate and to change. And it will change based on pressures. If you develop a drug that's very successful against a pathogen, the pathogen will then mutate and you'll see development emerge, drug resistance. That's what that is. And so I think variants have been a huge concern all along. The fact that we are now seeing some variants emerge where the vaccines remain protective, but a little less so, is setting up, one of the big concerns here. I don't think we're going to eradicate COVID, just to be very clear, at least not with what we have currently in our arsenal. We want to get COVID to a point where it's not something that puts people in the hospital. If we have widespread vaccination, it doesn't really impact our lives and it becomes more like a regular, measles, for example. We don't worry about having huge outbreaks, even when we see individual cases of measles. But the question is, even if we get the US very well vaccinated here and quickly in a way before additional variants have emerged, if we can't work to get widespread vaccination around the world, I do anticipate that we may continue to see the emergence of additional variants. And that could set us up for needing to do booster shots down the line or have additional protection. I hope not. And in a lot of ways, we've been a little lucky here that we've not seen as many variants as, frankly, I might have expected, given how many opportunities this virus has had to mutate because of the enormous number of infections and opportunities that it's had.
To someone who doesn't know that much about viruses and mutation rate, it seems like a lot.
Think about the flu. The flu has, we have to get a flu vaccine every single year. And that's because there are so many different, not just variants, but full strain, genetically distinct types of flu. And they are all circulating that literally every year, the public health folks and the scientists say, which of the strains or the variants are circulating the most? Let's take a guess of what we expect this next season to look like. And we create a vaccine against certain strains. And then it's a good match if you've done a good job in terms of guessing which strains are going to be the most prevalent. That's not at all what the conversation is, thank goodness, about COVID. But the question is, will additional variants emerge, particularly related to vaccine? I'm feeling confident in the short term. It's just going to be, can we get everybody vaccinated in the long term?
Returning to the playbook, in the face of such a huge public health crisis, do you scrap the playbook and start over, or do you return and just make improvements using what you've learned?
Yeah, absolutely. That's a great question. So we have, people probably don't know this, but we have a significant program at the Chicago Department of Public Health, and there are programs like this around the country, that is called Public Health Emergency Preparedness, or FEP. And our emergency preparedness folks' entire job is to plan for public health events of significance. And we practice, just so people know, 17, 18 times a year here in Chicago, where we have things like the marathon or Lollapalooza or events that bring a lot of people together. We actually practice things like communication and potential for, significant numbers of people getting hurt, for example. And we plan for these infectious disease outbreaks in partnership with hospitals and healthcare partners. And way before COVID, every single month here in Chicago, we have a sort of preparedness healthcare coalition that literally meets and talks about how can we be prepared as a city for public health threats. So definitely we do not throw out what we learned. And in fact, we've tried hard to create a little bit of space, even during this pandemic, to do what we call sort of after action reviews around particular portions of the pandemic. So we've got folks who, every couple of months, what are some lessons that are learned? What are things, for the future that we want to record? Because when you can't wait for COVID to be over to do that, you'll have forgotten things from early on. But yeah, I think they're always, if you're going to be a well-prepared agency, you want to say what went well, what didn't go well, what were we be prepared for, here in Chicago, we were much more prepared for some things than a lot of places. And then there were things that I think nobody was very prepared for. And to be stronger for whatever comes in the future, you want to be very clear-eyed about ways in which you can build systems and invest in whatever needs investing in to do that work. So my emergency preparedness team is definitely not going anywhere. I mean, they're very busy right now in emergency response, not just preparedness, but it is, I think, it's been a long-term focus and strength here. And I think it's one of the reasons we've done comparatively well compared to some other places is because of that preparedness work. And it's certainly something that I think the country overall has recognized it's something that needs major investment. And I'm excited about being able to continue to grow that work.
So using what you've learned, how much preparation is then tactical and resource driven, and how much is about public education and appealing to the culture of sickness and disease response in this country?
Yeah, that's interesting too. There's a lot of work that happens very behind the scenes. For years before this pandemic, let me tell you, we were investing millions of dollars in things like stocking up on N95 masks, keeping warehouses full of gloves and keeping various medications in supply and all of the control that needs to happen for them. And I'm going to be honest, there's a lot of people who question that kind of an investment that say, there's a lot of needs right now here in Chicago. And should you really be investing in purchasing things that you may never need? But I think if this pandemic has shown anything, it's that doing some of those investments and making sure that you have some sufficiency. And I think this has been learned at the national level, actually, much more so than it has locally. And even thinking about supply chains, there's a lot of behind the scenes work. I think on the public facing front, it's going to be interesting. I feel like as a result of COVID, certainly people are more aware of public health. Historically, people, maybe when they think health, they think health care. They think about the doctor's office or the hospital and where you go after you get sick or to treat your illness. And public health is really much more about preventing disease and about what systems do we have in place to prevent disease or prevent the spread of disease. And how do we work on the root causes that make us be able to be healthy. And so public health is also thinking about healthy neighborhoods and issues of safety and food access and safe housing, in a healthy way, and many other root cause work. And I think that COVID has laid bare that, and the health department has been focused on inequities for a long time. COVID has really brought that conversation into the mainstream. And I'm hopeful, sort of looking ahead here, that there will be more widespread public interest and support for the kind of work that we really need to do as a city, and I would argue as a country, to work on the fact that there are major disparities in chronic disease outcomes across this city. And when we see that in turn is what puts people at different risk for infectious diseases. We probably need to work on policies, things like ensuring that if you are working in Chicago, you have access to sick leave policies, right? Like there are real lessons that I hope people will take from COVID and be willing to be bold about in their decisions, in their own personal lives and their support for policies and for initiatives, and use in some ways, I never obviously wanted COVID to happen. Nobody did. But given that it has happened, I really want, at least here in Chicago, us to take some of what we've learned and actually make a healthier Chicago as a result. So a lot of the investments we've been making for COVID, obviously we're making them for COVID, but we're trying to think about how do we turn these investments into long-term investments that have the ability to further public health goals, especially in the neighborhoods that tend to lag in public health indicators. So we're trying to think, much longer term there. And I think the city at a broader level is, and I think that's a smart thing really for everybody to do.
Shifting a little bit, you touched on the relationship between knowledge of personal and public health. There's been a lot of conversation about mental health and mental health solutions in the public sphere. Were you surprised by how big this conversation has been? Is mental health a commonly discussed aspect of public health in the same way that physical health is, especially in pandemic situations? And do you think this increased focus on mental health will change the public discourse surrounding health more broadly in the future?
Yeah. So at the Chicago Department of Public Health, we had actually already, prior to COVID, we had identified mental health and then behavioral health more broadly. We also talk about our work with substance use, which we've seen change in ways related to the pandemic, and violence prevention. All three of these we think about in some ways collectively as we're working on interventions. And Yes, I think this also has really, I don't think there's anybody in the United States that hasn't had some impact to their mental health, frankly, as a result of this pandemic. And I think opening up some of the conversation around this, recognizing that there are ways to support. I think the move to virtual has been really interesting. Like the Chicago Department of Public Health, we operate actually some mental health clinics, and we've moved those to virtual. Therapists are able to see their patients across the whole city without some of the transportation issues. That doesn't work for every patient, but for a lot of people, it has actually led to some increased access. And it's going to, it's sort of a bigger conversation, but we want to really think about making sure that mental health is thought about like physical health, that there's not a stigma attached to it, and that there are ways that for everybody to have sort of better mental health, even as we want to make sure people with perhaps the more severe forms of mental illness who are needing to really make sure they get connected to care, we get them connected to care, but that there is absolutely no shame. There should be no shame in, going to the doctor's office to get your blood pressure treated. There should be absolutely, no shame, no hesitation in getting support around your mental health. And so we have really, I'll tell you that, the behavioral health section has been like the one section at the whole health department that I have really tried to keep them doing what they are doing, keep working on building mental health work and connections across the city, keep working on the substance use work and then the violence prevention work, knowing that these indirect effects of COVID are in a lot of ways what's going to live beyond COVID, right? People are going to recover, or unfortunately, obviously we've had a lot of people not recover from COVID, but the longer term effects of this are as much about mental health as they are physical health. And we've been working hard, and we've gotten some additional, we've actually advocated for additional federal funding around this too, that this is another thing that I want to take the conversation that has been opened up and turn this into stronger mental health. And, Mayor Lightfoot, Mayor of Chicago, had set as a big priority already, it was like where our budget was growing here in Chicago. And it's, we've seen almost a tripling of that budget, right? And with COVID coming in, even more ability to get people connected and build a system here in Chicago so that everybody is able to access that support. And we don't think of it as separate from physical health. And we think about all of the underlying public health work that helps build a stronger mental health system.
Are you seeing this trend of prioritizing behavior and mental health in other parts of the country, other cities, nationally, or is Chicago really leading the charge here?
Yes, I think big cities in particular have had a focus on this. And it is a newer area, right? Where you think about more traditional public health work and epidemiology, most of that grew out of infectious disease, like we've seen with COVID. But we really doubled down here and said, we're going to have behavioral health epidemiologists. We're going to create teams that look at data and approaches in the same way that we look at infectious diseases. And I think we certainly are part of this larger conversation in public health. And a number of other cities, I think, have also played some leadership roles here. And the CDC has started to fund some cities directly to do some of this work. And I think it's really, it's an area I've long had an interest in. And it's one that is in some ways, I think, a very good fit for public health approaches, where we're thinking about how do we make sure that we are getting to everybody and we are creating environments and policies and systems that promote mental health while we work to connect people to the care who need it. And I've got a really good team here who's doing all sorts of exciting things. And, we're standing up some crisis mental health work in ways the city just had not done previously, and getting some financial support. I think there's political interest in it. And I think on both the mental health and behavioral health, as well as some of the work we've done around people experiencing homelessness, some of the urgency of this last year has been great in terms of pulling partners together, getting things done, getting new investments, and we're going to be able to build from here in ways that I think are going to be very, very good for Chicago.
So the last thing on mental health, what's some advice that you would give to people who are struggling to move forward and still carrying the burden of this pandemic? How do you get back to normal?
Yeah, I think one thing is just recognizing that normal may not feel normal for some time. And that in and of itself is normal, that people are having a range of experiences, and that we need to have patience with each other and wanting to make sure that people do feel like they have somebody to talk to. And, we have information on the website and others. There are hotlines, but there are also sometimes this might mean someone in your family, in your friend group. It could mean somebody in your religious organization. It could mean mean a therapist. It could mean someone who's available just on the other end of a telephone line who you may never meet, to talk about it. But I think, we're going to be sharing, in the months to come, we're actually going to be rolling out some additional resources around this. And this idea of we want to speak about this. This is something we want to speak about. And often having the strength to be a little bit vulnerable, to have the strength to say, there are things I continue to struggle with. Because let me tell you, everybody